and welcome to the Executive Outlook. I'm Isha Taneja, your host, and today we are joined by John Lynn, founder of Healthcare IT Today, with over 20 years of experience in healthcare IT. We will be diving into how AI is transforming healthcare, the challenges in scaling the healthcare IT, and what the future holds for tech in this industry. John, thank you for being here. Welcome to the Executive Hour.
Yeah, thanks so much for having me. Excited for the discussion.
So, you have been into healthcare IT for over 20 years. So, how you get into this field and what keep you motivated all these years?
It's funny, 20 years is hard to comprehend. I think it just means I'm old and I've been around a long time. But yeah, when I first started, for me, I'm a tech guy by background. I'm literally tech guy on Twitter, right? That tech is where I started. And the thing I love most about tech is that tech can transform any process, any industry. And so that's actually, I think, probably my biggest passion is, how do you leverage tech to transform everything? Not that tech is always the solution. Sometimes there are other solutions or combinations of solutions, but tech can enable all sorts of new things. So I actually started in higher ed IT doing technology stuff. And then I got a job at UNLV in their health and counseling center, and they hired me to implement their electronic medical records. So that was really my first dive into healthcare. That's the thing that I'm most passionate about. And then I was able to see firsthand is implementing the electronic medical record at UNLV transformed the processes that they had. At first, it was a challenge because we tried to replicate the paper processes. And then we realized, wait, we could do a lot more interesting things because using the technology. And we went through, kind of the classic tech adoption cycle where we went back and said, okay, let's optimize for the IT workflow rather than our previous workflow. So anyway, that's where I came from. And still today, 20 years later, I'd say that's the thing that's most exciting to me is how can technology be leveraged and the capabilities that technology and now AI is part of that can allow an organization to do things that previously they would have thought that's impossible.
Amazing. So, basically, it excites you to automate the processes through technology, all right? So, what has been the hardest challenge you have faced in your career and how you have overcome that challenge?
What's the most challenging thing? COVID was by far the biggest challenge. Especially as a media company going through COVID, all the conferences shut down where we did our work, so we couldn't go to conferences, and all the budgets just froze unless you were paying for COVID. But they're not going to pay a media company for COVID, right? So that was certainly the hardest time, and it was the most interesting in some ways because every healthcare organization was kind of at the epicenter of what was happening with COVID. And so they had pressures and they had technology needs. And so there was lots of really interesting stories. But, from a media standpoint, budgets were just frozen, or marketing budgets, they weren't spending money. So it was a really challenging time. My colleague Colin during that time, he said, hey, what if we did 100 interviews in 100 days and just kind of gave back to the health IT community as a way to feature them and what they're doing, And I was like, wow, that sounds like a terrible idea. It ended up taking probably 200 days or something, but we did do 100 interviews. And ironically, born out of that was all of the work in video that now is core to what we do at Healthcare IT Today. So in some ways, COVID was the most challenging time and, really a crazy time for everyone, of course. But it also, from that, bore fruit of being able to realize, hey, the power of video is incredible. And now it's such a core part of our business. So it became a blessing to us in Healthcare IT Today.
So, how is AI evolving in the healthcare industry?
It's changing so quickly. Like, how do you even keep up with it? That's the interesting challenge. And I think what's most interesting about how AI in healthcare is evolving is we're in this weird time, and it's a tech cycle that I talk about a lot on the podcast and a lot of the discussions that I have. It's like, hey, before we implemented the EHR, We initially implemented a pharmacy system and a lab system and a revenue cycle system and an electronic health record and et cetera, et cetera, et cetera, right? Because the EHR didn't have all of those things. And then eventually Epic and Cerner, which is now Oracle Health, and Meditech and a bunch of others, they created all of those. And the Beaker lab system from Epic wasn't as good as the other lab system. Hey, but it was all on one platform. And so then now everyone just uses Epic across, 40 different things in their organization. And there's, like they say, one neck to ring if there's a problem, right? One vendor that all has an integrated solution. Well, we're kind of in that same stage right now for healthcare and AI. There are 100 or 1,000 or whatever. There's so many point solutions that do one thing like really well. And the problem is, if I'm a CIO leader, I'm like, well, I really kind of want one platform or maybe 3 or 4 platforms, right? Like one clinical AI solution and one radiology AI solution and one revenue cycle management AI solution. But right now, there isn't a platform that does all of those things. So that we're in this tough conundrum where, and it's a classic tech cycle that we go through where CIOs are like, well, I need to do something. I need to have an AI plan. I need to have exposure to AI and what's happening. But I wish I could just implement one platform, but that platform doesn't exist. Anyway, that I think is the biggest challenge that we have today, as a IT leader in healthcare, is saying, hey, there isn't one platform. So what can I do today? And who are the right people that are going to build that platform so that 2-3 years from now, I'm on the right platform that could do all of my clinical AI, for example.
That's interesting. And what is one misconception people have that it is holding back from fully implementing and adopting AI?
Yeah, I actually want to steal from Zach Cass. He's a former guy at OpenAI, ChatGPT. He provided a perfect framework, that taught me so much about why don't we adopt AI? What's holding us back from doing it? And he offered 3 points that I think are super interesting. The first is that as humans, we love autonomy. We love having our agency and being able to control the situation. And so AI is taking away some of that autonomy, right? Like look at self-driving cars. We don't want to do it because we like to control the car, right? So that you have to overcome that feeling of wanting to be, autonomous and be able to have control of the situation. The second is that there's this incredible asymmetry of information. To use the self-driving car example, self-driving cars are safer than humans driving. But in our minds, we haven't processed that information and we haven't gotten all of that information to realize, oh, wait, actually self-driving is safer than a human. In our minds, we still feel like it's unsafe and it's not as clear, right? So we have this asymmetry of information where we think something is risky when in fact it's actually less risky than not doing it, right? And then the third one that he offered is that humans have this exceptional tolerance for human failure. And we have an exceptional intolerance for tech or AI failing. So, same thing, right? If a human gets in a car wreck, of course, that makes sense. We're human. That happens, right? But, if an AI, a self-driving car does it, how would that happen? We shouldn't use it, right? And so, anyway, you apply all 3 of those things to any AI solution in healthcare, and you can see the problem, right? We want to be, doctors want to be autonomous. They want control of the situation. They don't, and 2, they don't trust AI, and they don't trust that AI could actually be better than them, right? That they have this misinformation. Well, in some cases, AI isn't better than them, right? And so, it's a tough challenge to overcome in their mind to realize that AI could actually be better. And that's, evolving quickly, that AI is getting better than the doctor in certain situations. And how do we understand that, right? And then, of course, we are fine with a doctor not treating a patient the right way. We're like, well, they're human. They did the best that they can. They did the best with the judgment and the information they had. But when it comes to AI, well, shouldn't it treat the patient perfectly? And so those are the challenges, right? All of those 3 are barriers to us saying, hey, we want to adopt AI.
Absolutely. So you have shared a different point of view, and that's amazing. Thank you so much. So healthcare IT today has become such a good platform for the news on healthcare tech. So do you want to share what some breakthroughs you had that has really made a real impact on operations or patient care or other areas?
Yeah. I mean, it's extraordinary. That's actually part of the problem of AI, is that AI is impacting every part of care and operations in a healthcare organization. So you could almost choose any area and say, yeah, that's being impacted and there's potential solutions there. But there's two that kind of stand out for me right now. One is the AI scribe, the ambient clinical voice, where you walk into the exam room, you hit record, you say, hey, are you okay if I record the session? The patient says yes, and then you just see the patient. And when you walk out of the room, the note's created for you. Now they're starting to even do the coding for you. They're starting to, they're setting up prompts that tell you, like, from the voice interaction between the doctor and the patient, what else do you need to know? What else do you need to consider? So to me, that has been the most transformative technology that has hit healthcare in more than a decade, in 20 years. I'd say I've often said it's the most exciting thing since $36 billion of stimulus money for electronic medical record, and it didn't take $36 billion of stimulus, right? It was exciting enough because the solution is that impactful on people. Are there still nuances to work through? Absolutely. Is it going to be embedded in the EHR? Yes. How is that market going to play out is really interesting. But that solution itself, whether it's from the EHR, whether it's from a third-party vendor, and whether they expand the AI solutions to a full AI clinical suite, that's going to be interesting to see play out. But it's been the most transformative clinical thing to take away the operational minutia from doctors. And then the second one I would add is revenue cycle management. There are so many areas of revenue cycle management that are being impacted by AI and technology that it's just absolutely incredible to watch. So many things. Again, it goes back to what I said. What am I most passionate about? We can do things that before we would have been, why would we do that? So let me just share one simple example from revenue cycle management. There's this thing called low balances. Basically, someone owes some money, but it's a small amount. Well, you look at the small amount and you're like, well, I'm going to spend more money having a human try to collect that than the balance itself. So it's like, why do I do that? Okay, that makes total sense in a human-driven world. Now apply AI to it. Well, AI is just cheap, right? It can reach out to the patient. It can call the patient. But it's inexpensive for the AI to even call the patient or message them or however you want to interact with it. And so it's like in an AI world, those low balances, that's something you can do. And so, it's just a simple example of how technology enables something that in the human world, if I were to apply human to that problem, shouldn't do it at all, right? It's not worth the investment. But with AI, it makes a lot of sense, and you can go collect those low balances and contribute to the bottom line of the healthcare organization. So there's hundreds of other examples for revenue cycle, prior auth being one of the most interesting as we kind of look to automate and, improve that process. But both of those areas are really interesting and really powerful.
So will humans accept that? Like someone AI is calling you and they are asking for different areas about yourself, about the health, right? So will it be accepted by humans over the
Well,
period of
the other question is, do they have a choice, right? If the AI bot calls you, I mean, you could choose to hang up. But what's interesting is we've actually seen what is fascinating is that the bots that call people have gotten so good that many of the people, and in particular the older generation of people, literally don't know the difference. They think they're talking to a human. And so when you hear some of the recordings, sometimes you're like, wow, they really think this is a human, but it's actually a bot doing it. So, to be fair, it is going to be a transition. Many of us are going to say, wait a minute, do I want to do this? And many older people are not even going to realize what's happening. But the reality is, if they get the service that they want, if they get the care that they need, then I think most people are okay with it. It will be interesting though, right? Because right now, the older generation may want that phone call from a bot. They don't want to have a text message or an email. They're not checking it the same way that you and I probably are, right? And so that's going to transition from a phone call for the older generation to once you and I'll be a much older generation than you sooner, I'm going to want that chat bot and I'm going to want them to text me that information. I'm not going to answer my phone because I'm going to think it's a spam one. So the nice thing is the technology works either way. Technology can call you and have a human voice experience, or it can do it through text message. And by the way, it accomplishes the same thing. So in some ways, the technology adapts for whatever our preference is. But I just really think that in most cases, that they're not going to have a choice. The bots are going to call, and if you don't answer, or you don't reply, then you're not going to get the care or the service that you want. I think whether they want it or not, it's kind of, they don't really have a choice.
In order to achieve these scenarios, like bot is calling the patients or humans, right? So in that scenario, like, as you worked on different areas, so what is your recommendations of different tools which are your favorites?
There's so many. I often go and I've done keynotes for different events and stuff where we feature it, and that's what's amazing is that there's so many different cool tools that are happening that are amazing. I'll use a couple that I've seen recently. One that I think, hey, here's a prediction for you, Isha. You know, I think that this year is going to be the year of the robot in healthcare. And we're going to start seeing a lot of robots roaming around the hospitals and health systems and doing all sorts of things. So these humanoid robots are becoming really popular. And the reason why it needs to be a humanoid is it needs to be able to navigate the hospital in a way that's useful. So, what we've found, intuition robotics is one, that there's a whole bunch of them. VC just has one that came out. And so we have these humanoids that are going to be going around the hospital doing different services. Some of the things that they're going to be doing. One is transport. It turns out nurses spend a ton of time running to the pharmacy, running to the lab, running back from the lab to the... They're transporting something to the lab or transporting something from the pharmacy to the patient. Well, bots are much better at that. They can go pick that up. They can come back. They can navigate it. Turns out it's a tricky problem because they have to be able to touch the elevator. They have to be able to get on the elevator and tell it which floor it wants to go to. They have to be able to swipe in and do security, right? But the nice thing is a humanoid robot with a working arm, right? Which makes it human-like. It can do that. It can touch the elevator. It can go traverse floors. It can do security swipes. It can have its own badge, right? Like, how funny is it that a robot has a security badge to be able to navigate the organization? But so transport is a really cool option and solution for healthcare organizations. And it turns out that this is true in rural health just as much as it is like a large academic health center. So that's one example. Another example is these robots that actually do telehealth. So they have these robots that go into the room almost like a nurse, right? Like the nurse can have the robot, hey, I want you to go to room 556, right? And the robot goes there and it has a camera and it has a screen and it has everything. And they can go in there almost like they walked in there, but instead the robot's walking in there and they can have that discussion with the patient. So I think telehealth is really interesting with a robot that can actually walk around, that can look at the thing, that can zoom in, that can move around and can look at the face, it could look at the leg, it could look at whatever's needed, just like a nurse might do. So I think that's another one. The third one that's interesting is around supplies. And how do you move supplies around? How do you verify that supplies are being restocked and making sure that the right supplies are in the right place at the right time so that when the nurse goes into the supply room, they can find what they need. So I think that's another area we're going to see robots. So anyway, there's three nerdy robot ones that I really like. If you move outside of the robots, I actually love what's happening with AI and things like credentialing. Credentialing is a massive problem. Workforce is a massive problem for most healthcare organizations. They need their people working as quickly as possible. And the credentialing and approval process for these providers, a new doctor, a new nurse, whoever it is that you want to onboard, can be really onerous. It has lots of hoops that you have to jump through. You have to collect all this information from the doctor, and then you also have to file that information with the state and with the medical society and with the insurance companies, et cetera, right? It's just this onerous process, and it's perfectly designed for AI. Because AI could reach out to the doctor and say, I need this document, right? It can reach out to the medical society and file the forms. These days, AI can navigate their crappy old website, right? Yeah. that they're doing, right? And it can submit that information for them. It can even go out to public sources to collect the data for the doctor and say, hey, doctor, is this the right data? And the doctor can just verify it. So that's another cool area that I'm seeing AI applied, that I think is really interesting, is in that credentialing and onboarding process for clinicians. And then, of course, we already talked about RCM. We talked about the AI scribe, the clinical AI. The other clinical AI that's really interesting is the summarization of the chart. There's so much information in the chart. Summarizing it for the doctor turns out to be a really valuable thing. And it can be summarized based on their specialty. If I'm, orthopedic surgeon, do I really care about, some of the other specialties that you're going to? Maybe not, right? It can surface the information that's useful for me. So that's another example. Radiology AI is maybe one of the most progressive. I don't know what the future of radiologists looks like, but man, that's evolving quickly. So that's another area that's interesting.
So, with all these exciting innovations and coming into your hospitals, healthcare area, so what do you think about human impact, like over the jobs, over other areas? So, will it be there, or what? According to you, it will gonna expand. The scope will be expanded as AI will gonna enter into their lives.
Yeah, and I think that's the interesting challenge. But this is one we've dealt with forever, right? How many people are still doing the job of managing horses, right? Like, sure, the car came and then now you don't have wranglers dealing with horses the same way you did, right? And you could apply that to anything. How many people, how many jobs were replaced once word processor came, right? And we were able to type and we didn't need someone to type, everything up for us, so that job is gone. So are we going to see jobs disappear? Absolutely. We are going to see jobs, many jobs that people hated, quite frankly, because they were, redundant tasks that didn't take a lot of intellect, but, needed to be done. Now that's going to be taken over by AI. But what we're going to see is that new jobs are created. So I think this has always been the case with evolution of technology, is that as technology improved, certain jobs disappeared and new jobs were created. So, is it going to be an equal sum? I don't know. Certainly there's no exact math to this problem, but the reality is certain jobs are going to be replaced. Do I think all jobs are going to be replaced? No. I don't think we're ready for a AI bot to do my knee replacement. That still isn't going to happen. I'm not ready for a bot to, give me a cast and replace my bone, right? When I break my bone. So there's going to be a lot of things where we are going to need the human, to be able to take care of the patient. And that's true. And then also we're going to also have the human oversee the AI to make sure that the AI is working effectively and it's working properly, and to coordinate the AI, right? There's going to be a lot of jobs where humans are coordinating these AI agents. So yes, some jobs will be gone, but new jobs will be created. And, that's always how it's been.
Amazing. Lastly, I want your advice you want to give to the new leaders, executives, how to stay ahead of this rapidly changing trends and like AI era that is here.
Well, selfishly, they should read Healthcare IT Today now that we're doing videos and podcasts and everything. To be frank, it's hard, right? There is so much happening. So I would give a few things. One is first, start doing. Because by doing, you learn so much. And if you're not doing, then you're not learning. And so whether it's finding a pet project or whether it's applying it in your own personal life, right? Are you using the technology to plan your vacation so that then you understand the technology better and then you can do a better job when applying it to healthcare, right? Like that's a powerful thing as well. So at your work and your personal life, use AI and learn the pros, the cons, the challenges, everything that's needed. So that would be the first thing, is start doing, and that will connect you to other people who are doing as well, which is the second suggestion, which is have a great network, right? Having a network of people that are also involved in AI, they can bubble up what's real and what's fake, right? They can bubble up what's effective and what's not so effective. So having a great network and connecting with that network and sharing your ideas, I think is the second one. And then the third one is don't be afraid to fail. Right? Like it's okay to make some mistakes. Turns out that doing nothing can be damaging to your organization as well and can be risky because you're not benefiting from the technologies that's there. Sure, be thoughtful in how you make your mistakes, right? This is healthcare, right? We lead with do no harm for a reason because there are literal lives on the line. But be thoughtful and be okay and create a culture where mistakes are okay, and instead create a culture where if a mistake is made, how do we recover quickly? That's a better culture than doing nothing, which causes its own damage to an organization. So I'd say those are probably my 3 points of advice.
Amazing. Thank you so much. And that's a wrap for the today's episode of the Executive Outlook. A big thank you to you, John, for sharing your insights with us. Thank you so much.
Thanks for having me. It's a lot of fun.
Yeah.